Hi friends, welcome to my channel. I'm Dr. Greeshma. Today I am discussing my point of the subject I am discussing in English language because after the last video I got a lot of messages and requests from my abroad patients to do a video in English. So we can go for today's topic. The topic for today is a diet plan good for a hypertensive patient. That is the diet plan good for a blood pressure patient. So, as we all know, the blood pressure or the hypertension is the most villain in our present scenario, present society. Because of our diet and our daily activities, our stressful life, everything. We are suffering, a lot of patients are suffering from this blood pressure and how we can reduce the blood pressure. So, today I am discussing about that. As we all know, what is the blood pressure or the hypertension in a simple definition? The force executing by the circulating blood on the walls of the artery, that is blood pressure or hypertension. The hypertension we are measuring by using two measurements. We are taking by two measurements, that is one is systolic and the other is diastolic. What is systolic? That is the pressure exerting when the heart is in expansion state. And the diastolic is the pressure exerting by the blood when the heart is in relaxation state. So as we all know, the normal value of blood pressure is 120/80 for a healthy person. When it is little bit increased, that is the 120 values increased to 130, we call it as the pre-hypertension state. And the systolic value is increasing 80 to 90, also the pre-hypertension state. And when the value is again increased, the systolic is increased to 140 to 150 and the diastolic is increased to 90 to 100. It is the first stage of hypertension. The first stage of hypertension and the pre-hypertension state is little bit serious. We have to take it as serious and it is dangerous. So we can control this hypertension state of first stage of hypertension and the pre-hypertension state by controlling our diet. So today we are discussing about that. Before going for the diet, when you are searching for what are the causes for blood pressure, to increase the blood pressure, the first thing is our diet. The high amount of salt in our diet, fat, oil, cholesterol in our diet. The next thing, when we have any problem with our kidney or diabetic, the blood pressure also will increase. The main other thing is from the familiar history, that is hereditary. From my parents, from our parents or our relatives, when they have the diabetic also, and the hypertension state, we got the blood pressure. And the last thing is from our sedentary life activities, our daily life routines and the lack of exercises, everything. These are the causes for the hypertension, to increase the hypertension or the blood pressure. So I'm discussing about a diet which has a very good role to reduce the hypertension. That is the DASH diet. It is very famous and internationally accepted diet. When we are searching for a diet in the Google without side effect to reduce the blood pressure, that is, we can see the DASH diet is the very important one. What is DASH diet? That is the Dietary Approach to Stop Hypertension. That is DASH diet. What all things are included in the DASH diet? When we are searching for that, the main thing is include more cereals, include more vegetables, then fruits, and also we can include more amount of water in our diet. Cereals like we can use rice, wheat, pulses, grains, etc. When you are going for with the rice, the brown rice is more good than the white rice. So it's better to use the brown rice in your diet. And you can use more wheat, some cereals and the grains like ragi, like that. And you can have more nuts in your diet like almond, walnut, etc. will have the ability to reduce the sodium in your blood and can maintain your blood pressure. Then you can include more vegetables. Vegetables like tomato, carrot, cabbage, broccoli, cucumber, these are, and also leafy vegetable. These are very good to reduce the sodium in our blood, and thereby that will increase the potassium amount and can reduce the blood pressure or the hypertension. Then as we are discussing about the fruits like orange, strawberry, watermelon, pineapple, etc., and more berries, more like sour like fruits that have more potassium and that have the property to reduce the sodium in your blood. So you can control the blood pressure or the hypertension like that. The major important thing is you have to drink a lot of water in your daily life. That is at least 3 liters of water. Water is very important in your diet. Because when you are drinking more, you can maintain the blood pressure, you can maintain the equilibrium of your body, and that will eliminate the waste from your body and will maintain the equilibrium. So you can feel the lightness and your body is in a well balanced state. So the drinking water is very important. The next thing, you have to do some exercises. Exercises like daily routine exercises, like daily walking and daily you are doing some household things or your own activities. That is daily routine exercises, and also some additional exercises like some stretching exercises. Can you do the yoga like Surya Namaskara, etc. We are telling us at least 150 minutes of exercises per week you have to do. It will reduce the amount of blood pressure that and the hypertension from your body. So, and also you have to keep your body in a balanced state, that is not to increase too much weight or not to make your body too much obese. You have to do some exercises to maintain that your body mass index should be in at least in the value of 25 is the appropriate or the correct value, and your circumference of the belly, the abdomen, is not exceed than 90 centimeter. So you have to do some exercises to keep on that. So these are the points that you have to include more vegetables, fruits, cereals like that, and also water and more potassium content nuts and foods, everything to increase the potassium in your body, and that's thereby you can reduce the sodium. That is the DASH diet. So by maintaining that, you can you can have a control over your blood pressure or the hypertension. And to obviously you have to reduce the amount of salt also. For a healthy person in a daily life, in a daily basis, they need only 5 gram of salt. And for a person who are in the pre-diabetic state or the grade 1 diabetic state, their need of the sodium in the food is only 2 gram. So as much you can reduce, wherever you can reduce the salt, that all places please reduce it to maintain your blood pressure. So it's very good to follow the DASH diet, exercises, drinking water, maintaining some healthy regimens like doing some meditation, yoga, breathing exercise. These are very good to reduce the blood pressure in your body. So this is the topic of today. Hope you like this and understand. If you have any doubt or any question, or do you want to know more about the treatment level, today I discussed only about the diet. About the treatment level, you can just message me or you can just mail me or comment me. I will definitely reply. Hope you like my video. If you like my video, like it, click the like button, and you can comment your suggestions. I will correct it. Okay, hope to see you next time with a new subject and new video. Bye bye.